The United States, a nation founded on the principle of life, liberty, and the pursuit of happiness, stands at a critical juncture where the health and well-being of its citizens are increasingly divergent. A complex and deeply entrenched system of healthcare, interwoven with pervasive social inequality, has created a reality where one's zip code can be a more powerful predictor of health outcomes than their genetic code. This disparity is not a recent phenomenon, but rather the culmination of historical, economic, and policy decisions that have systematically disadvantaged certain populations, while privileging others. The result is a fractured landscape of health, where access to quality care, life expectancy, and the burden of chronic disease are distributed unevenly along the lines of race, income, and geography. Examining the intricate relationship between healthcare and social inequality in America reveals a profound challenge to the nation's core ideals, exposing a system where the promise of a healthy life remains conditional, and for millions tragically out of reach. At the heart of America's healthcare crisis lies the issue of access, a multifaceted problem that extends far beyond the simple availability of insurance coverage. While the Affordable Care Act made significant strides in reducing the number of uninsured individuals, millions of Americans still fall through the cracks. Many work in low-wage jobs that do not offer employer-sponsored insurance, yet they earn just enough to be disqualified from Medicaid, particularly in states that have opted not to expand the program. This coverage gap leaves a vulnerable population uninsured and often forced to choose between paying for essential medical care and meeting basic needs like food and housing. Consequently, preventative care is often neglected, leading to delayed diagnoses and the progression of manageable conditions into life-threatening emergencies. When these individuals finally seek care, it is frequently in the expensive and inefficient setting of an emergency room, driving up costs for the entire system and perpetuating a cycle of debt and poor health. Furthermore, even for those with insurance, a policy card is not a golden ticket to comprehensive care. The proliferation of high-deductible health plans means that many insured Americans face substantial out-of-pocket costs before their coverage kicks in. This financial barrier can be as prohibitive as having no insurance at all, discouraging individuals from seeking necessary consultations, filling prescriptions, or undergoing recommended procedures. The fear of incurring a medical bill they cannot afford leads to self-rationing of care, with devastating long-term consequences. This is particularly true for individuals managing chronic conditions like diabetes, hypertension, or asthma, which require consistent monitoring and medication. The inability to afford regular checkups or vital prescriptions can result in severe complications, disability, and a diminished quality of life. The problem is compounded by a shortage of healthcare providers in many areas, especially in rural and low-income urban communities. These medical deserts force residents to travel long distances for care, a significant hurdle for those with limited transportation, inflexible work schedules, or mobility issues. Social determinants of health, the conditions in the environments where people are born, live, learn, work, play, worship, and age are the primary drivers of the health inequities seen across the United States. Economic stability is a fundamental pillar of this framework. Individuals and families with low incomes face a cascade of challenges that directly impact their health. They are more likely to live in substandard housing with exposure to hazards like lead, mold, and pests, which can cause respiratory problems and developmental issues in children. They often reside in neighborhoods with limited access to nutritious food, forcing a reliance on processed, high-calorie options that contribute to obesity, diabetes, and heart disease. The chronic stress associated with financial insecurity, the constant worry about paying bills, facing eviction, or losing a job has a profound physiological effect, elevating cortisol levels and increasing the risk of a wide range of health problems. This perpetual state of toxic stress wears down the body's systems, accelerating the aging process and leading to a higher prevalence of chronic illness. At a younger age, the quality of education and the physical environment are also inextricably linked to health outcomes. Educational attainment is a strong predictor of health literacy, employment opportunities, and income potential. Individuals with lower levels of education are less likely to understand complex medical information, navigate the healthcare system effectively, or advocate for their own needs. They are also more likely to engage in high-risk behaviors such as smoking. The neighborhoods in which people live further shape their health. Low-income communities and communities of color are disproportionately burdened by environmental pollution, with higher concentrations of factories, waste sites, and highways that release harmful toxins into the air and water. These areas often lack safe green spaces for recreation and exercise, contributing to sedentary lifestyles. Moreover, high rates of community violence can create an environment of fear and chronic stress, impacting mental health and deterring residents from engaging in outdoor activities. The cumulative effect of these social and environmental factors creates a cycle of disadvantage, where poor health is both a consequence and a cause of social inequality. Racial and ethnic disparities are one of the most glaring and persistent features of the American healthcare landscape, reflecting a long history of systemic racism and discrimination. Black Americans, for instance, experience significantly worse health outcomes across a vast array of indicators compared to their white counterparts. They have higher rates of infant and maternal mortality, a lower life expectancy, and a greater burden of chronic diseases such as hypertension, diabetes, and kidney disease. These disparities persist even when controlling for income and education, pointing to factors beyond socio-economic status. One such factor is the implicit bias held by some healthcare providers, which can lead to differences in the quality of care received. Studies have repeatedly shown that minority patients are less likely to be offered advanced medical procedures, receive adequate pain management, or be referred for specialized care. These biases, often unconscious, result in misdiagnoses, delayed treatments, and a general mistrust of the medical establishment among communities of color. This mistrust is not unfounded. It is rooted in a history of medical exploitation and unethical experimentation, such as the infamous Tuskegee syphilis study. The legacy of this history, combined with contemporary experiences of discrimination, creates significant barriers to care Minority patients may be hesitant to seek medical attention or may feel that their symptoms and concerns are not being taken seriously by providers. This breakdown in communication and trust can lead to poorer health outcomes and a failure to adhere to recommended treatment plans. Furthermore, a lack of diversity within the healthcare workforce means that many patients are treated by providers who may not fully understand their cultural background or the unique social context of their lives. Addressing these deep-seated racial inequities requires a comprehensive approach that includes anti-bias training for healthcare professionals, efforts to increase the diversity of the medical workforce, and policies that directly target the social and economic conditions that disproportionately affect communities of color. The profound inequalities in America's healthcare system are not abstract statistics. They manifest in the stark reality of divergent life expectancies. In cities across the country, a short subway ride can traverse neighborhoods where the average life expectancy differs by as much as 20 or 30 years. A resident in a wealthy, predominantly white suburban enclave can expect to live decades longer than someone in a low-income inner-city community just a few miles away. This gap is a damning indictment of a system that allocates health and longevity based on wealth and privilege. It underscores the fact that the opportunities for a long and healthy life are not equally distributed. The COVID-19 pandemic threw these disparities into sharp relief, as the virus disproportionately sickened and killed individuals in low-income communities and communities of color. These populations were more likely to be essential workers with higher exposure risks, live in crowded multi-generational housing that facilitated transmission, and suffer from the underlying health conditions that increase the severity of the disease conditions that are themselves products of systemic inequality. Ultimately, the intertwined crises of healthcare and social inequality pose a fundamental moral and economic challenge to the United States, a nation where a significant portion of the population is burdened by preventable illness, and premature death cannot reach its full potential. The economic costs are staggering, reflected in lost productivity, high healthcare expenditures on manageable diseases, and the strain on social support systems. But the human cost is immeasurable, counted in lives cut short, families broken by medical debt, and the squandered potential of millions. Moving forward requires a radical reimagining of health as a public good and a fundamental human right, rather than a commodity to be bought and sold. It demands bold policy interventions that not only expand access to affordable, high-quality healthcare, but also address the root causes of inequality. This includes investing in education, creating economic opportunities, building safe and healthy communities, and dismantling the structures of systemic racism. The path to a healthier, more equitable America is challenging, but it is a necessary journey if the nation is to live up to its promise of ensuring liberty and justice and the opportunity for a healthy life for all.